Hello. So, I don't know if anybody's going to watch this, but I have the cure for COVID-19. It's in my blood because I'm one of the survivors of COVID-19. I was diagnosed April 10th. I actually started feeling these symptoms a couple days before on a Wednesday, and I went in on the 10th, April 10th, 2020, to get tested. They didn't think I had it, but the very next day, very early on, they called me. You have it. They sent me on my app, my Vanderbilt app. They sent me the test results that I had it, that I was positive. So the very next day. So that being said, I went through it. It sucked. It took me about 16 days to heal. Um, and then they asked if I wanted to be part of the research. Yes, I do. But my email is so full of junk mail and mail from people because we're quarantined right now and that's how people are interacting, that it is exhausting and very difficult to find the important information, including the research from Vanderbilt that I was supposed to be a part of. So I have not done any of that because I haven't been able to. So today I'm calling the hotline to ask them, can you take my plasma today? And I'll be part of the research, and whatever you want to take, you can take that will help in curing COVID. Now, the solution for sure is every country, all 7 continents, working together, sharing what they know. Will we figure this out from our COVID patients? Will we figure this out? Coming together, sharing the information. And China went through it. I teach with VIP Kid. I was with them. They went through it about. It started, people say January, February. It started in like December, maybe even before that, before we even knew about it, it started. Um, and so they already went through it. So they've already been going through so much research. So we need to learn from China as well. Learn from the blood that they take and test from the patients that have gone through it. Learn from the plasma that they're taking. Learn from, which is part of the blood. Uh, Learn from not just the checkbox that you ask what we're going through, but what we actually did to solve it. So what I actually did, um, beating on my chest, beating on my back, just like an asthma patient, turning on the hot, steamy shower, breathing it in, putting my hands up, holding it in for 10 seconds. It was really hard and painful, felt like dots were in here, and then coughing it up because it automatically made me want to cough. So doing that continually throughout the healing process, that's what did it. And laying down too long was worse, so much worse, because the stuff hardens. It wasn't getting, putting the ventilators on, getting more oxygen is not helping because we need more oxygen. We need our bodies to allow the oxygen to come in, not to force more oxygen in. We need our lungs to be open to receive the oxygen. So we need to be coughing the junk out by this steam, and then holding your hands up, holding it for 10 seconds and spitting that junk up. So we need to be able to do that. But right now, how are we, the COVID survivors, how can we be part of the prevention and solution? Prevention, we can give the researchers real information of how we actually survived. The cure, giving our blood, helping those who are already going through it, and giving our bodily fluids to the people like at Vanderbilt University in Nashville, Tennessee, so they can do research and study and to be more prepared for next time for whatever comes, and also to help the people right now. Because quarantine, I follow my leaders, I follow whatever president we have, I am respectful and follow. But quarantine is not successful for this reason. Not, I don't want to say not successful, not completely successful, because anything that you come in, like groceries and stuff, it has been touched. The people are still at your door. There's still people. You're still coming into contact with people, unless you're like a farmer that's alone and you do everything on your own and you live off the land. That's the only reason that quarantine 100% works. So it's not saying that quarantine is bad. The whole debate on good or bad is irrelevant, because people also, especially in America, when we have a choice, are going to do what they want to do anyways. And you know that. The people that say quarantine is not good are going places. The quarantine pro quarantiners are staying at home. So the virus is still being passed around. So we need to just set those things aside, focus on the cure and the prevention, And that is focusing on the survivors that can help, and not forcing them, obviously. It's America, but in other countries, you can't force them. Encourage them, show them, hey, this person gave this person blood, and then show them the survivors and let the survivors talk. Let us see that on the news instead of all the death numbers and fear. Show them the stories that actually help so we actually know specifically how we can help, not fear. So we just stay in our homes scared. No, share with them how we can actually help. Show people giving blood, show the survivors that got the blood, and let them tell their story. That's what inspires. Let them tell their real story. Show that on the news. Show that. Let people hear that on the radio instead of all the death tolls, because that just causes fear. That just causes people to stay in their homes, and that may help a little bit. That's not going to solve. That's like when you take something and it cures the symptoms, but then the icky thing comes back up. We want to actually kill the cause, kill the virus. So we need to figure out the cure to do that, and prevention research for that. That's the answer to healing the world of COVID-19. Working together with our doctors and nurses and survivors. Doctors, nurses, and survivors are needed. Those three: doctors, nurses, survivors. And if you're not a doctor or a nurse, you are something in the medical field. And I may not know your name, phlebotomist. You are useful too. I'm including you too. If you don't know, I'm including you too. So those are the people who are going to be part of the cure. So those people, I encourage you to come forward and to call the nearest doctor, hospital that you have that actually does research, like Vanderbilt University, which phone number is 188 312 0847. And I wrote promote this because I'm trying to promote it. 188, this is the hotline you call to be like, hey, I had COVID and I'm either going through it, or I've already been through it, or it's been 14 days since my last COVID cough, my last symptom. I'm ready for the blood, to give blood. That's what you do here. 188 312 0847. That's in Nashville, Tennessee, Vanderbilt University. And you probably have a hospital somewhere in your state, at least, that you can call. And at least if you can't give the blood, which you can probably, but if you are not comfortable with that, at least do the research part and tell them exactly what helped you out, because you can help others out. And who doesn't want to help others out? We can help the entire world out. By just helping one person, you could help the entire world out. It's insane, but it's true. And the hardest part is getting people to work together. But the funny thing is, if even just one person comes forward and helps, that can change the entire world. And all the, should we quarantine? Should we not quarantine? When there's a solution and a cure, that stuff does not matter anymore. It doesn't matter. Hallelujah. So that's it. I encourage you to. My name is Kristi Carter, and I'm from Clarksville, Tennessee, very close to Nashville, Tennessee. I'm a COVID survivor, April 2020. And I'm calling Vanderbilt University today at 8 a.m. when they open. But until then, I'm going to promote them, and I'm going to try to encourage others that have gone through COVID and have survived to help others who are not surviving, because they're people. Yeah, I'm not afraid to go out anymore, because even if I caught it again, I'm like, my immune system's pretty darn good. Let's roll with it. But I care about those who do not have good immune systems. And if I can help them, I know you can help them. And so how we help them is helping the nurses and the doctors and the researchers, the scientists. We need to help the scientists. So the first step is call on that hotline, whatever hotline or doctor. If you don't know the hotline, call your nearest hospital and tell them the situation. They're going to send you probably to a hotline, and then you're going to be able to help from then on. COVID survivors unite. We need like a symbol, like a C. Is this COVID survivors unite? Let's roll. Let's do this. Okay. It's going to heal the world. Don't take my word for it. Do it. It's like that PBS. Don't take my word for it. When you open a book, just go do it. The cover is not the book.